So you perhaps listened to a news conference like that and remarks from the premiers through a different lens. They were short on specifics, but they all agreed that something major needs to happen. What did that signal to you?
So I am happy that the premiers are getting together to talk about the current healthcare capacity crisis that we're facing, not only in Ontario, but the rest of Canada. And it starts with these types of discussions and planning things out both short term and long term. The interesting thing about the quote we just heard is that, we can't continue with the status quo, but for a long time, healthcare providers, nurses, doctors, personal support workers, etc., we have been asking for better investments in our public healthcare system. It's a matter of whether there's political will to put those investments in place. There are a lot of things that we have in our system that are working and that could work even better, but in the current crisis, it needs more investment, and we need more sort of will for those long-term solutions so that our healthcare system doesn't have these capacity challenges moving forward.
The province has long been asking for more money, more money and transfer payments. Is a Team Canada approach to healthcare feasible, Doctor?
I mean, it's hard to say. Like, each province has its own unique characteristics. And, I think that the relationship between the federal governments and the provincial governments is complex. I mean, what works in Ontario may not necessarily work elsewhere. But I think fundamentally there are a few things that we could be doing a lot better on. So, for instance, recruitment and retention of nurses. There have been ideas that are floating around now that we probably should have put in place a long time ago. Things like helping pay for registration fees, training more international nurses that have come to live in Canada, better salaries, better mentorship. These are all things that we could easily put into place. Primary care needs more investment. I mean, in Ontario, every family medicine resident is trained in a team-based approach where they work in an integrated team in the community to provide comprehensive care so that people don't go to the emergency rooms. But when they get out into real practice, there aren't enough of these team-based models. So we need to invest in more of those so that more people are excited to go into family medicine. Seniors, more people are getting older, they're living longer. We need more investment in home care so that not every senior that isn't fully independent at home has to go to a long-term care facility. So all of these things need better investment. And when you don't invest in them, they end up in acute care settings like hospitals, which then takes away from things like surgeries and acute care issues that should really be the focus there.
Well, let's talk a little bit more about family medicine. I have remarked to you in the past, Dr. Grill, that you always come on positive, optimistic. You clearly enjoy your job, regardless of the situation and the circumstances. What is your message to medical students to pursue a career, given that we have such a shortage, and in particular, family medicine?
Yeah, I'm a huge proponent of family medicine. I really enjoy what I do. I love the patient interaction in the office. I like doing hospital work. I like doing some work in palliative care, long-term care. Family medicine has such a rich variety of scope of practice. There's so many things you can do for your community. And working in an integrated team-based model like I have in Ontario with nurse practitioners and chiropodists and social workers, it's a real family environment that you could work in. It's wonderful. And we have long-lasting relationships with patients, babies, midlife, older seniors. It's absolutely wonderful. But in order to sustain that, in order to convince more medical students to go into the specialty that we all have learned to love and enjoy, we have to continue to invest in it. We have to continue to build these team-based models. We have to continue to work on ways to sort of limit some of the administrative burden that we have within the system. And there are ways of doing that with working in these team environments. So family medicine is a wonderful career. More people are going to be interested in going into it. But in order to sustain it, let's look at what's working in terms of the team-based comprehensive model, and let's build on that. Ontario's done that with Ontario Health Teams. I think other provinces should also focus on that type of model, and then more people with this integrated care will continue to enjoy family medicine and what it has to offer.